Hello and welcome to Mature Matters. My name is Debbie Clark and I will be your host today. We have a very special guest. Her name is Cindy Balo. She's a respiratory therapist at Botsford Hospital in Farmington Hills, Michigan. Thank you, Cindy, for taking the time out of your day to come and speak to us about pulmonary rehabilitation. Welcome.
Thank you for having me.
Oh,
Such
definitely.
a pleasure.
Yes. Well, since you're here, I think it might be important for our viewers to know what is your background, what have you done, where have you been?
Well, I've been around this field for a long time, Debbie. I've been a registered respiratory therapist since 1987. I got my associate's degree in respiratory therapy from Oakland Community College and my bachelor's degree in sociology, and I have a health education minor at Eastern Michigan University.
Wow, that's interesting, and that would really come in handy with the type of job that you do educating your patients in that area.
It's helpful for sure.
Yeah. So I understand you've had some pretty interesting ventures in your life as far as your experiences.
Yes, I have. I'm pretty proud to say that I've worked in the acute care setting for probably close to 16 years, and after that I did air ambulance. I worked for an air ambulance company based out of Ypsilanti, Michigan, and flew in Learjets all over the world. It was like a mini hospital on the jet, and I've been to Africa, Jordan, all sorts of countries, taking care of people that were ventilated or impending ventilation, and they need a respiratory therapist, so we'd fly them to different places to seek better care from wherever they were initially.
Yeah, that's
so
awesome.
It was fun.
Yes.
And I've done emergency care. I've worked with neonatals. I've done it all, but right now I'm doing pulmonary rehab, and this is what I love to do now. This is what I've done for the last 12 years.
That's awesome. I think the big question for our viewers would be is, what is pulmonary rehabilitation? What does it entail?
Well, pulmonary rehab is a program that usually takes 10 to 12 weeks, average 2 to 3 visits a week for about an hour each. And what we do is we work with the patients to try to strengthen them, to improve their breathing capability, and basically try to return them to a prior level of function. A lot of our patients have, through the years, decreased their activity level, and they become complacent. They aren't able to do the simple household chores that they were able to do, or work in their yard, go shopping, groom themselves, different things that we take for granted. And so we work slowly and diligently to try to give them some type of independence back and try to teach them that it's important that they don't stop doing things, but to do it in a different way. And then we're educating them and we're exercising them, trying to strengthen their muscles. You know, we have found, and it's a proven fact, that weaker muscles require more oxygen than a stronger muscle. And so we work all the muscles. We work the legs, the arms, the diaphragm, and the heart, trying to strengthen them so they won't require as much oxygen. And we've actually successfully weaned people off of oxygen.
Wow, that's amazing.
Yeah.
If somebody comes to you, Cindy, and they're not able to physically tolerate what may be required in your program, is there something else that might be an adjunct for them to think about?
Absolutely, Debbie, and it's funny because where we're located at, we actually have physical therapy department, occupational therapy. We actually have speech therapy down the hall from us. And so sometimes when we evaluate a patient and we're doing endurance testing on them, we find that they have a physical anomaly that they might not be aware of that could inhibit or prevent them from doing what we need them to do. And so if it's not going to be beneficial to them or we're going to harm them, we suggest that they might get physical therapy. And so we would speak to their physician, tell them what we found, make sure it's okay with the patient, and then we try to set them up with physical therapy. We have run physical therapy concurrently with pulmonary rehab with some patients, but depending on their level of debilitation, it might be difficult for them to do both therapies. And so they might pause with us, go to physical therapy, fix whatever injury that they have, and then come back and resume pulmonary rehab with us.
Oh, that's great.
It's a blessing. It's
Yeah,
nice.
absolutely. Do you have a doctor that oversees your pulmonary rehabilitation program?
Yes, we do. Wilfred Vanderoost, he is our medical director. He oversees everything. He is our biggest fan, and he is our biggest supporter. And he's very, very good with us and loves us, and we love him.
Sure, that's
He's
great.
very good.
It's nice to know that you have a qualified physician that oversees your programs too.
He is very qualified, and we also have 2 licensed respiratory therapists. Actually, we just hired a casual licensed respiratory therapist, but we work daily with 2 licensed respiratory therapists, and we have an assistant or a tech that helps the respiratory therapist with the therapy on their patients, and also with our maintenance people that have graduated and chose to come back to exercise. And we have office managers. We have a nice, cohesive group of people that work really hard to help everybody.
What type of patients would you see in this setting?
Most of our patients are, all of our patients are chronic lung patients, meaning the disease that they have has to be chronic but rehabilitatable. It can't be an acute occurrence of a disease, for instance, acute bronchitis or acute asthma. It has to be something that they have had for a long time and that they're medicated regularly for. Most of the time it might be a COPD, chronic asthma, chronic bronchitis type patients, but those are usually the ones that we see.
What would qualify this group of people to be able to come and see you?
Well, first of all, they have to have a qualifying diagnosis. There are too many for me to go through, but
Sure.
they have to have a qualifying chronic rehabilitatable disease. And then they have to have a pulmonary function test that has had to have happened within a year of their first appointment with us. That's the 2 things that qualify them.
I see. One thing that comes to my mind is if just a person's watching this show and they've never been diagnosed, but they know that they get very short of breath with activities of daily living, what would your suggestion be for that person who hasn't been officially diagnosed with anything?
First thing, they need to see a physician. They can go to their family practitioner, or if they see an internist, that's fine, but they go to their physician and communicate the problems that they're having. And hopefully the physician would suggest that they might need pulmonary rehab. So if they need pulmonary rehab, they would call us, and this is very commonly happens, where the physician's office might send us a prescription, and then we would look and ask, have they had a pulmonary function test within the last year?
Okay.
If they have not, we let them know that if they don't do it in their office, we actually do it at the clinic. We do it where we do pulmonary rehab, we do pulmonary function testing. And so that's really nice because we can actually qualify the patient instantly. If they come to us for a pulmonary function test and the physician is interested in them having pulmonary rehabilitation, we can and we have looked at the test afterwards. We have the literature that qualifies them, notify the physician that they do qualify, and then before the patient goes home, we can set them up with an appointment immediately for their first initial evaluation.
Oh, that's good.
So that's nice to know.
Yes, and a friend of mine recently, she went to get a pulmonary function test and was very happy with the results because she's been sick for many, many years with some sort of lung issues, especially like sick with the change of weather and things along that. And she was diagnosed with COPD. And she said she wasn't compliant at all because she just didn't feel comfortable with the diagnosis. Well, she did go for a pulmonary function test and came to your department and was very pleased with the care and was very pleased with how she could get the results online. And I just talked to her last night. She is so much better, is breathing so much better because she felt like she did have a very good solid diagnosis that her doctor got from you all and that she's being compliant, and she is very appreciative.
Wonderful. Good to
Yes.
hear. Thank you for letting us know that.
Absolutely. So when the patient comes to see you, you said they need a prescription.
Correct.
Does insurance cover this?
That's where our front office person, the very most important person of the whole program, because she makes sure before the patient comes in the door whether they qualify. And if they have any type of a copay, that's brought up right away. It's very important for people, and now with the healthcare laws changing, sometimes it can be a deterrent, and it's very sad because people are missing out on something that could be very helpful because they can't afford it. So yes, it's important that they find out, and they will find out. Not every insurance covers it, but more and more are starting to cover pulmonary rehabilitation.
Right, and I know even in a lot of aspects of patient care, everybody's getting bigger deductibles
Yes.
and higher co-pays.
Yes.
But from what you're saying, you really just need to look at the whole picture and know how important that this could be to help you with your everyday functioning.
It is very important, and we're hoping to get the word out to the hospitals because lately now there are readmission penalties for certain diagnoses, and we're trying to show, and it is a proven fact, that pulmonary rehabilitation does help keep people out of the hospital and help keep them alive a lot longer. And so we can get that word out, not just for our program, for all programs around, then the hospitals should realize that that will help them also. So they should instantly, try to get the patients into a pulmonary rehab program that's close to where they live, so that will prevent the frequent readmissions into the hospital.
Right. Something that just came to my mind, can any doctor write a prescription for this?
Yes, actually,
Okay,
yeah. And I think that some people think it has to be a specialist or a lung doctor, but no, we often get prescriptions from family practitioners, from cardiologists, from pulmonologists, from internal medicine. Those are usually the 4 top ones that we hear from. We've heard from dermatologists sometimes, but those are usually the ones. But yes, anybody can write a prescription for it. And then let us do the legwork and let us find out what they've had done and whether they qualify or not. And we communicate with a physician and with the patient to make sure that they get in as soon as possible.
Right. So if everything goes good,
yes,
you get the script and your insurance is verified and you're there for your first day to see you, what can I expect as a patient?
Well, you can expect to be here about 2 hours with me because we're going to and wear comfortable clothes, but we do a little question and answer session. Actually, we sent out a packet to the patient with different questionnaires about their health history, their diet history, their depression history, different things like that that are affected by their breathing capabilities.
Sure.
And so once we have them come in, we look over their questionnaires, we do a 6-minute walk. It's a test that we like to see how fast they can walk at a comfortable pace, how low their oxygen drops, how high their heart rate goes. This is just something that we can tell what they might tolerate when they walk on a treadmill. And then after we do all the questions and answers, do the 6-minute walk, then we do what we call an endurance testing, where we put them on exercise equipment at a low intensity just to see how long it takes for them to fatigue. And we take all that information. It takes usually 90 minutes to 2 hours, and that's the end of their session. And then based on all of that, we set goals for these people to achieve, whether they choose 2 times a week or 3 times a week. We usually keep them for 12 weeks, theoretically, sometimes longer, sometimes less. And we set goals for them, and we get ready and start slowly building their endurance and increasing their strength and improving their quality of life.
Yes. So on the educational side, what would you teach a patient? I know they do their exercises and they have their questionnaire. What would you teach them about their, I guess you could call it a disease. What would you teach them about the issues that they're having?
Well, a lot of times people don't understand the disease that they have, and so we give them a history of how they could have gotten it, why they might have gotten it, and different signs and symptoms and ways that they can be treated for that. It's important for them, and a lot of them don't even understand. They were told they have COPD, or they were told they have pulmonary fibrosis, and they don't know what that means. And so that we explain what their disease state is, and then their education is very individual for each patient.
Sure.
You know, I might talk to one person about oxygen therapies, different delivery devices, safe oxygen use around cooking or household habits, and somebody else might not have oxygen. So our program is very individualized based on
Sure.
each patient. If they need nutritional information, we give them nutritional information. If they need to learn how to do things at home easier, or how to protect themselves from the elements, or asthma triggers, different things like that. It's all specific to each patient.
Sure.
And then we have literature to back it up so that they can go home and read afterwards. And of course, we focus on pursed lip breathing techniques and diaphragmatic breathing techniques to improve their breathing when they find themselves in a situation where they might panic or have shortness of breath. So many patients have said that out of all the things that we've taught them, that helped them more than just about anything.
That's great.
So,
can you tell me one thing that you do for diaphragmatic breathing?
yes, I can. Actually, I'm proud of this because I don't know a lot of pulmonary rehabilitation programs that do this. However, at the end of the exercise session, probably 99% of our patients look forward to this, but we lay them down for 10 minutes and we put an ankle weight on their diaphragm area, because the diaphragm is the muscle under the lung. That is what becomes very damaged or debilitated through years of poor breathing technique. And after a while, these patients are using their shoulders to breathe. So if you ever see anybody like that, you pretty much can diagnose that they have some type of a chronic lung disease. We try to strengthen all the muscles with the exercise, and then we finish the exercise session with an exercise called diaphragmatic breathing or resistance breathing training. And we lay them there and teach them a breathing technique that will strengthen that muscle and try to build that muscle back up again.
Wow.
Oh, it's nice.
Yeah, very
It's
nice.
Mm-hmm.
What options do the patients have? Like, I know with some of my friends who are in different types of therapy, patients come in, you educate them, they know what they need to do, and then their therapy stops, their rehabilitation stops.
Mm-hmm.
And they're like, what am I going to do now? I mean, I know you've educated on what to do at home during their sessions, but what options do they have at that point?
It's funny you say that, because we actually we have grown men cry when we graduate them, because you don't think about it, but we tell them what to do all the time. Little by little, we're trying to sneak instruction in them and teach them to be independent with it. However, they get used to us telling them what to do. So we do have a phase 3 maintenance program that we offer for the patients. We do give them home exercise program in case they choose to exercise somewhere else, but we offer the place to them. And it's comforting for some of them because they come back to a place that's familiar. We try to teach them independence. We teach them how to set the machines. We teach them how to increase their endurance on each machine on their own
good.
without instruction.
Sure, good.
But we're always there. If they kind of get complacent and do the same thing all the time, we try to encourage them to change what they do, because we teach them muscle confusion and how important it is to keep challenging themselves. But they can come as many days as they want, and they're usually there for 90 minutes. And I'm actually proud to say that we have a few that have been there 9 and 10 years. So
wow.
We've seen them for 2 or 3 times a week for 10 years, and they're family to us. And for the patients, I think they form a camaraderie because they care about each other.
Sure.
They get to know each other, and they actually ask about each other if they don't see one of them showing up for a while. I've actually been given strict instructions from some of my patients that I am to tell the others when they're in the hospital, and then I can break the privacy law and tell that they're okay, because
Right.
they care about each other and love each
Sure.
other that much.
Oh, absolutely.
So
like you said, it's
nice.
like a family
It is a family. It's our
atmosphere.
family.
Right. Yes. Other than that, Cindy, I can't really think of anything. I mean, we totally appreciate you taking your time out of the day to come and tell us about the things that you do and love to do every day. And the only thing I can say is, for the viewers out there, if you are interested in this program, please, number one, talk with your physician and see how he feels about it. Obviously, get a prescription and The contact information will be at the end of this show, and we would truly love to see many of you feel better, breathe better.
Thank you very
become
much.
healthier. Thank you so much
Absolutely.
for your time.
Thank you so much for giving me this opportunity.
Absolutely.
Thank you.
And thank you all for taking the time to watch this show, and we will see you all soon.